Questions?
Okay, so this is a pretty general question about the body. Um, and so there's, I've come across this idea in a few different places about like the body keeping emotional residue. Some people call it trauma, or Eckhart Tolle calls it the pain body. And I feel like there's a lot of confusion around this, at least for myself, and but probably in like the general population as well. And so I guess I was wondering how important this idea is, and if, I guess for me personally, if I should be, how much I should pay attention to that. And then I have some other questions about like various techniques as well. And
Okay. All right.
but yeah, let's start with that.
Okay. I think if you look further into the pain body as described by Eckhart Tolle, and he acknowledges that it's something that he's just kind of invented as for ease of discussion, and it's also, I think,
Right.
very useful for folks.
Right.
But it's not I don't think it's so much the physical body, but it's more like emotional habits, little nodules of conflict that exist in one's psyche, and that can be triggered by any number of things: boredom, or somebody else, or seeing the old man again, the husband again, or
Right.
one more time the dog crapped on the doorstep. I don't know, so that's a that's an emotional pain body. Now, there's also no question that the mind body is one unit, and so the emotional pain can get manifested in the physical body in terms of muscle contraction, for example, in terms
Yeah.
of and then there can be habits also of the body, like gastric spasm and irritable bowel or something like that,
Yeah.
or bad posture,
Yeah.
or certain aches and pains. And then we have a whole world of psychosomatic illnesses, including uh, physical disorders, right? And I've known people to develop, for example, rashes on their palm, which is, in medicine, that's very, very rare,
Mm.
uh, for psychological reasons, clearly psychological reasons.
Mm.
And any number of other physical ailments. I mean, anyone who says that the body can't manifest the pain or the conflict in the mind doesn't know the body mind. But I think what Eckhart Tolle was referring to was something else, and I could have missed this, right? But I think he's more referring to the those habitual patterns of thought that create emotional turmoil and create pain, anger, bitterness, resentment, all the kind of negative stuff. And I think this was brilliant of him, although I don't think there's going to be a medical or a psychological uh, concomitant to this, describes this as a pain body, and he reifies it. Reify means to make real. And so once you make it real like that, it becomes easier to manage in the psyche. It becomes more like an object. And so kudos to Tolle for this. I think it was a very nice, pragmatic, and useful stepping stone for people. And so follow up to that.
Um, yeah, I guess the the Tolle's idea makes sense. Um, but um this the other idea where like the pain and stuff is manifested in the body. Um, so
Well, this would be Freud, right? Freud was all over this stuff. I mean, he called it conversion reaction, and he talked about neurotic conflict. Neurotic meaning just uh, mental, unconscious with conscious, and there'd be conflict, and it would be manifested in some part of the body that was symbolized by the For example, not to get too graphic, but in women in the middle of the last century and before that, it was not uncommon for them to develop pain in the inguinal area, or vaginismus, pain in the vagina, over conflicts around sex, right? And there's many examples of things like that. So people would develop symptoms that were related symbolically in the unconscious to the conflict. Or men would develop impotence, or someone develop and then there's the real thing of, you know, if you're heartbroken, I mean, your heart actually hurts, right? It's really interesting. I mean, it's your chest that, I mean, it's physical pain. Now we're into the realm of psychoanalysis, and that has a huge long history. Well, huge long history. It has a history that goes back to the Greeks, but in the Western world, it goes back to Freud at the turn of the last century, literally about 100 years ago, and there was a lot of work done on these kinds of things: conversion reactions, psychosomatic reactions, and then they changed the name so it didn't offend the patient. They called it something else. They called it somatic body disorder. And if you look at DSM, I wouldn't go past DSM 3 or 4, and I hesitate to even go to those. But there's a lot of descriptions of the different syndromes in which this is a salient characteristic: the conversion of psychological distress into a physical symptom. And so that's a huge world in psychiatry, psychoanalysis, depth psychology. But if you could be more specific, then I might be able to be more concrete.
I guess, how do you recognize? Well, so I'll speak about myself here.
Well, not too much, right?
Okay.
It's very important. We don't want anything identifiable.
Sure. Well, I'll just say, like, I have pain in my legs a lot, like muscle pains, and like, you know, feels like cramping or discomfort and that sort of thing. And I don't know if it's like psychosomatic like that, like it's some manifestation of something, or if it's from like sitting too much and bad posture, or doing sports or that sort of thing. And so I've been trying to like pay attention to it and figure that out. But
that's right, exactly. You become your own detective, right? And you become your own scientist, and you have different hypotheses, and you test them out, and then you ask, you know, and this, none of this is practicing medicine, you know, on the interwebs.
Right.
So, of course, but the things you'd want to know are okay. First of all, if someone is an athlete and someone's using their legs a lot, and then they're not using their legs, or the opposite, maybe that it's just simple muscle pain because the muscles are having to grow. You know, when you grow muscles,
right,
you rip them. You rip the little myofibers, you know, that
right,
make up the muscle, and then there's usually some soreness as the muscle grows. On the other hand, now just for fun, if I was a psychoanalyst, or if I was practiced as a psychoanalyst, I'd wonder, does this man have a leg to stand on, right? For example. And then you would use dreams, you'd use the unconscious, representations of the unconscious, you'd use symbology, and you'd say, well, what do legs represent for a young man, right? And there's no reason why both of these can't be true. We're complex, to put it lightly, organisms. And there's as we know now, there's literal minds in different parts of the body. There has to be, because they have to solve problems, right? Like the liver or the kidneys. And so I don't know why one or the other wouldn't be why they both couldn't be contributory. But there was a third factor that I left out, and what was that? Can you refresh me?
I'm not sure what you're referring to.
Well, there's body, mind. There's also metabolic. Now that I think about it, if you don't have enough potassium, for example,
right,
you can get cramping in the legs. And then there's a whole list of other things that are possible, you know, like blood clots and things you don't need to worry about. So you look to see if it's symmetrical, then it's not likely to be focal. I mean, it's not likely to be, one blood vessel or one nerve, right? And so again, but the key here is for people to take responsibility for their body minds and their pain bodies, and to investigate it on their own and say, well, wait a minute, could this be, I mean, could it be in the brain? Well, if it was in the brain, it'd likely be both legs, right? If it's peripheral, it's more likely to be one leg. So if it's both legs, then it's less likely that it's central. But if you're doing exercise with both legs, or you're lifting weights, for example, then that rule doesn't apply. So it's just like that. But the thing is also, the vast majority of these kinds of symptoms, they will pass with time. And Freud, and not just Freud, but a lot of psychiatric folks would say that it's very important to try and understand these symptoms once you've ruled out all the medical serious problems and all that, because they have symbolic, they're there to kind of to teach. Now, did they go overboard? Maybe. Has that whole body of understanding been neglected? Absolutely. And now we've gone for taxonomy, this is this and this, and we're going to list the symptoms, and if you have 6 of these and 3 of these, then you get this, right? Or this, and that's just silliness, right? Unless you're in court or something. So for the individual person, forget that and just try and understand, what is the body telling me? Because it's usually trying to tell you something.
Yeah.
Follow up?
So what are some techniques for trying to understand it? Because I feel like at this point I spend a lot of time like observing it and trying to understand it, but it seems like you could do that forever and not get anywhere if you're not doing it properly.
Well, 2 things. One is, I can't, and I don't, because I'm no longer practicing psychiatry, do practice on I just don't do that. And there's a danger of this. This is why it'd be better if you talked about a friend or something. So I don't want to speak to that except in the most general terms. But the second question is, when you say forever, what do you mean by forever? Because for a young person, forever could be something much shorter than it is to somebody middle-aged, for example. And so what do you mean by forever?
I mean, one can imagine spending your whole life obsessed with some issue.
Right, and one can imagine one's whole life with a pain body.
Right.
And so I'm assuming there's no medical or metabolic or physiologic cause, and all those need to be ruled out. So go see a doctor, go see whatever, whatever you need to like make sure that there's nothing metabolic or physiologic or mechanical or so assuming all that's out, then you've got what's called a pain body of sorts, but it's manifest in the physical body. But I'm not sure that's what Eckhart Tolle meant by pain body, but let's use it anyway. So now you have a symptom and you wonder, well, what does this mean? And I can't, as it says in the Tao Te Ching, those who know do not generalize.
Right.
Those who generalize do not know. So I don't want to go much further than that. But if we had another example that didn't involve you, because that's the kind of thing we'd have to discuss offline, right?
Yeah.
But that's kind of what I can do right now, in this forum or this format.